In this video, we are going to learn about drug interactions and its types. So what is drug interaction? It is the change in action or side effects of a drug caused by concomitant administration with a food, beverage, or another drug. The outcomes of drug interaction could be beneficial or harmful. In beneficial, the well-recognized interactions, they do not pose any undue risk to the patient. Many medical conditions are treated with a combination of drugs. Antibiotic is used along with an analgesic to treat painful infective conditions. Adrenaline is combined with lidocaine for local anesthesia, etc. Some examples would be amoxicillin and clavulanic acid, sulfadoxine and pyrimethamine. The harmful case of drug interaction, it is unintended antagonism and loss of therapeutic effect, or it can lead to toxicity, either antagonism or toxicity. Antagonism means the two drugs cancel the effect of each other and there is no effect, no therapeutic effect. So drug interactions are thus mostly undesirable. They're rarely desirable or beneficial. For example, enhancement of activity of penicillins when administered with probenecid. The types of drug interactions. First one, the drug-drug interactions. It is a change in a drug's effect on the body when the drug is taken together with a second drug. When two drugs are given simultaneously, one drug may cause modifications to the effect of other drug. This type of interaction can be seen in prescription drugs as well as over-the-counter products, OTC drugs. In the case of prescription drugs, a drug interaction may be used to produce an intended therapeutic response. Sometimes it can be harmful. For example, the interaction between warfarin, an anticoagulant, and fluconazole, an antifungal. Their interaction can lead to a dangerous increase in bleeding. Whereas in the case of over-the-counter drugs, when aspirin and anticoagulants such as warfarin are given, they increase the risk of major bleeding. Also, diuretic and ibuprofen. Diuretic is something which helps to get rid of excess water and salt. Whereas ibuprofen may cause the body to retain salt and fluid and hence decrease the action of diuretic. So, diuretic and ibuprofen combination is not recommended. Now let's move on to the next type of interaction, drug-food interactions. Food affects the rate and extent of absorption of drugs from GIT. Many antibiotics should be given at least 1 hour before or 2 hours after the meals to achieve optimal absorption. For example, riboflavin or vitamin B2 absorption is enhanced in the presence of food, whereas dietary items such as milk and other dietary products that contain calcium may decrease the absorption of tetracycline derivatives. The next one is drug-alcohol interactions. Chronic use of alcohol beverages may increase the rate of metabolism of drugs such as warfarin and phenytoin, probably by increasing the activity of hepatic enzymes. The acute use of alcohol by non-alcoholic individuals may cause an inhibition of hepatic enzymes. which would obviously result in a decrease in metabolism. And the use of alcoholic beverages with sedatives and other depressant drugs could result in an excessive depressant response. And if consumed in high doses, cross-tolerance occurs between alcohol and other CNS depressants. What is cross-tolerance? It occurs when tolerance to the effects of a certain drug produces tolerance to another drug. It often happens between two drugs with similar effects. In this case, alcohol and CNS depressants. The next one, the drug-smoke interactions. Smoking increases the activity of drug-metabolizing enzymes in the liver, which lead to rapid metabolism of certain therapeutic agents and hence decreased effect. For example, chlordiazepoxide, diazepam, propoxyphene are metabolized more rapidly and their effect is decreased in heavy smokers. Hence, there is rapid metabolism and decreased therapeutic effect. The next type of interaction is drug laboratory test interaction. Some medications can interfere with specific lab tests, which would in turn result in inaccurate test results. Example, tricyclic antidepressants have been shown to interfere with skin prick tests used to determine whether someone has certain allergies. How to reduce the risk of drug interactions? First, identify the patient's risk factors. Take thorough drug history. Be knowledgeable about the actions of the drugs being used. Consider the therapeutic alternatives. Educate the patient and monitor therapy. Avoid complex therapeutic regimens when possible. This is for the physicians. What is the role of pharmacist in reducing the risk of drug interactions? Advising patients regarding the proper use of medications is important. Educate the patient on foods and beverages to avoid when taking medications. Keep up to date on potential drug-food interactions of medications to counsel the patients.